We're at Advertising Week, New York. This is AW360 Live. I'm BJ Smith. I have with me Chris Neuner from PulsePoint. Welcome, how are you doing?
Good, BJ. Nice to see you.
So, how has your experience been with the Healthcare Marketing Summit here at Advertising Week?
It's been great. One of the things that I give credit to Adweek on in particular is singling out healthcare within its own dedicated track. Despite the numbers of how important global advertising is for healthcare, it's roughly 9% of all total spending. Healthcare transcends above just the numbers.
Right.
It's around reaching patients, it's around reaching physicians, specifically to educate them about health outcomes and health issues. And interestingly enough, whether this was done by design or not, Robin Roberts, who was such an inspiration to so many in the health community, was literally the session right before the health track. So it led to some great flow from people who were inspired about her journey through health and what we were talking about specifically on the stage in the Health Marketing Summit.
So in terms of digital marketing, how is it impacting the healthcare industry?
Well, digital marketing allows you to do so much more with the proverbial so much less.
Sure.
And one of the things that you have to understand within healthcare is that there's this movement towards specialty medicine. Gone are the days that you and I might remember where Lipitor for high cholesterol was on all the major networks, and you had this sort of spray and pray approach, reach a large target of statin or high cholesterol sufferers. Now it's around reaching very specific acute conditions, whether it's small cell cancer or rheumatoid arthritis. And so digital marketing is allowing data and information to have a conversation with a very specific patient population in many different ways, whether it's through mobile, video, social. So that type of communication is a lot deeper in that communication.
I know that healthcare is such a sensitive industry. How are you collecting data to actually be able to properly target?
Well, at PulsePoint, that is one of the issues that we are trying to solve for. I showed a statistic just a few minutes ago that showed that 73% of the advertising industry is transacting programmatically using data on top of the internet to show information. Yet in healthcare, it's only 37%. So it's literally half, and it's because of that nascency. It's because healthcare and pharma doesn't know what to do. So there's a few ways. The first is programmatic advertising has a few built-in measures, whether it's fraudulent traffic or contextualization that is able to make advertising more relevant. Secondly, it's around finding a curated list of environments or websites that are proven for healthcare marketers. And then with great power comes great responsibility. I don't mean to be too trite in everything that I say, but it's then what to do with that data. So if you're seeing cancer information and then all of a sudden you're getting tracked throughout the internet, whether you're on New York Times or ESPN, and it's not thinking about the human factor, we're taking those environments and those situations and plugging it all into our healthcare exchange.
Are there other factors that you look at as far as maybe geographical factors? One of the things that I did in a podcast a few months ago, we were talking about healthcare, and this was how it relates to the outdoors.
Yeah.
And one of the interesting statistics we were looking at is how like nature and parks relate to certain, urban environments where there's not quick access to park, and we could overlay that and see high episodes of diabetes and heart disease and all these other things. So are you able to take data like that and say, you know what, maybe there's probably a good chance that there's going to be some diabetic issues over here.
100%, and it's such a good question. There's a few ways to attack that. The first is there's certain industries like clinical trials where a patient is not willing to go 20, 30, 40 miles outside of their home area.
Okay.
So let's say somebody who's been looking at diabetes content that might be dissatisfied with their current treatment, that we can target that person within a certain geographic location. Secondly, hospitals. Hospitals always look for patients, within their community. So being able to target specific geolocation factors in order to do it. Third, the way that you're talking about it is higher propensity models.
Okay.
As certain areas, as you look at medical claims data, have a higher propensity of disease penetration in certain areas. But one of the things that we have to think about is also sensitivity.
Right.
And so, take HIPAA, which protects medical information when you're at a doctor's office. And we have the ability to target physician offices. And imagine if you were at your doctor's office and then you were online and you were looking for diabetes information. If we were able to plug that information, couple that with your browsing behavior, we think that's crossing the line.
Right.
That's
so they could say, this person probably has
diabetes. And so while the industry hasn't necessarily caught up to look at those specific scenarios, we at PulsePoint have created something called the Programmatic Health Council. And at the Programmatic Health Council, we look at compliance, we look at data, and we self-regulate to say what, as an industry, when we have agencies, the largest healthcare publishers, the largest health data companies, all sitting around the table saying, what would you do in this situation? And what's more importantly, the right thing to do in this situation. So and it's one of the reasons why, as well, healthcare companies have been a little bit slower to jump in to make sure that it's a safe environment to do it. We are making sure all of those questions are being answered, because the power and the opportunity to have a one-to-one conversation with a consumer with that type of information, it's exciting.
That's great. Well, Chris, thank you so much for joining us. And this is probably a good time to remind folks that we are streaming our sessions live. And if you wanted to go back and watch the Digital Health Summit, which you're part of earlier today, that will be available online too. So Chris, thanks for joining me.
BJ, thank you for your time.
Absolutely. We'll be back with more AW360 Live from Advertising Week New York.